Thank you very much, UP Open University and ANSAP for organizing this event and for also to be able to share also the best practices of different nursing administrators in the country. So I am tasked to present to you and discuss to you the initiatives of our hospital with regards to the response to COVID-19. So again, I'm Harby Abellanosa from Cebu South Medical Center, formerly Talisay District Hospital. And this is our experience in our hospital with regards to COVID-19 response. So just an overview of our hospital. It was created in 1999 by virtue of RA 7799. And in 2016, it was upgraded from 50 bed to 300 bed. And just this month, the president approved its renaming from Talisay District Hospital to Cebu South Medical Center by virtue of Republic Act 11473. In terms of manpower profile for the nursing service, currently we have, all in all, we have 234 manpower, 166 of which are nurses, and 74 are non-nurses. These are nursing attendants and midwives. And we also have 10 units in the nursing service, 4 of which are the general nursing units of our wards, and 6 are specialized nursing units or our critical care areas. And since the start of this ECQ, we have established 4 different units in response to COVID-19. One of which is the triage. This is a general triage before getting inside the hospital. Second is our respiratory ER. Third is our OB and SARI and ED ward. And fourth is the respi ward, which I'll be explaining further later. So here's our strategies and identified good practices within the nursing division of our hospital. So I have identified 4 strategies and at the same time good practices. First is quick assembly of nursing staff. Second, workflow optimization. Third, focus group training. And fourth, very important, organized internal support for our nursing personnel. So quick assembly of nursing staff. As we all know, the president declared the state of calamity in the entire Philippines last March 16. And immediately after that, March 17, there was already a declaration of state of calamity at the same time. Enhanced community quarantine in the Luzon first, followed by declaration for the entire Philippines. Right after that, on March 18, the nursing office was very quick to organize its manpower. So we had an emergency meeting of all department managers or supervisors, and we talked about how to strengthen our COVID-19 triage system and to ensure that there will be available PPE. So one of the topic was distribution and allocation of PPE for all nursing units, and including the other service areas of the hospital. Then also in this meeting, we have identified areas as our front line for the COVID response. And then we have also discussed together with the nurse managers the possible movement of staff to COVID response units. So we have assigned or we have deployed nurses from the non-COVID area to our COVID response units. And immediately on March 22, a nursing memo was released already with the list of identified staff to be assigned in our COVID response unit. So as early as that, we have already set up the COVID response unit with the corresponding manpower. And just this June 22, the nursing service office created an ad hoc team. The ad hoc team is tasked to monitor, evaluate, and recommend appropriate measures in relation to COVID-19 response of the nursing service division. The entire units was audited, utilizing the checklist provided to us by the Department of Health. So this is the actual memorandum of the checklist provided by DOH This is entitled Use of Infection Prevention and Control Assessment Form for Health Facility Managers and Healthcare Professionals in the context of COVID-19. So this is what we use as our standard for auditing our nursing units. So all areas were audited for the following. First, assessment and triage of patients with acute respiratory illness, source control measures and patient placement, implementation of standard contact and droplet precautions, visitor management and exclusion, requirements for performing aerosol generating procedures, monitoring and reporting, and occupational health. So this audit came after almost 2 months after we have already implemented our COVID response. This was created for us to know if where are we in terms of our response in COVID-19 and how are we in terms of the standards given to us by the Department of Health. Now, this is a picture of our audit. These are two of our auditors, our unit manager and department manager for the intensive care unit and emergency room. They just made an audit. So the audit actually was, they went inside our COVID response units or COVID ward to check the implementation of standards within the identified COVID response area of our hospital. The second strategy, and at the same time, what I can say as a good practice is workflow optimization. So the workflow optimization includes the manpower and the materials. So March of this year, the civil service, the HR body of all government agencies here in the Philippines, issued their interim guidelines for work arrangement in support for mechanisms for workers in the government during the public emergency. This was our basis in formulating or revising our work schedule. So immediately after the release of that circular from civil service, we have shortened the working hours in the entire nursing service and also for the entire hospital. So meaning instead of going almost every day to the hospital, we have shortened it by reducing the number of duties from 8 hours to a combined 8 to 12 hours and ensuring that the 40 hours requirement as stated in the circular will be met. And for the nurses in the patient care areas, they only have to report 4 days a week. And for our nursing office, we require them at least 10 hours every shift, 10 hours every day for 4 days. So the staff in our nursing office was divided into 2 groups. First group reports on a Monday and second group reports on a Tuesday. Then second, under the workflow optimization is centralized PPE allocation and distribution. As you can see in the presentation, we really made a personalized packing of our PPE. In this, we have controlled really the distribution of PPE, and we're very, very strict in terms of providing PPE because we made sure that we have complied with the rational use of PPE as prescribed by the WHO and DOH. So only COVID response areas were given these appropriate PPEs. Same with the strategy of PGH, where they have identified also based on the risk level of the area. So this is how we do it. We centralize the allocation and distribution of PPE specific to all units. And then we have ensured that all staff would be able to receive really the PPE, especially those that are considered as frontline for the COVID or the COVID response. And also, our nursing staff, since at that time, there was already a memorandum or a directive from DOH that elective surgery will be suspended. So our nurses at the operating room, together with our administrative assistant in the nursing office, we fabricated our own face shield that was provided to all personnel in our hospital. So these are the new areas, still part of the works optimization, the new areas established dedicated for COVID-19 response. First is the COVID triage. This is a tent outside the hospitals to make sure that everyone that gets through will be checked for the temperature and other profiling. Second is COVID triage 2 and ER resuscitation area. We, together with the infection control, we have devised that all resuscitation will no longer be at the main ER. Instead, we place it outside in an area where there's a good ventilation. Then the respite ward or our COVID ward, and then recently we came up with our OB-ELI ward because we have noticed an increase of COVID cases for OB cases. So this is a picture of how we do it. The tents were provided to us by the local government of City of Talisay. So this is the triage where the patients would be assessed first by the nurses before they'd be able to enter the hospital premises. And this is our respite unit or our COVID ward. We have to put some partitions because we're not able yet to install the negative pressure. So what we did is just we made a partition and observed a social distancing or physical distancing of the beds. And this is what we also did in our OB-ELI ward. This is formerly a OB low-risk ward, but since we saw an increase of cases in OB, we have converted our OB low-risk ward as an OB COVID ward. This already has its own DR complex and labor room. No need for the OB patients to go to the main OB complex. So just at the COVID ward dedicated for the OB. And third strategy is focus group training. Despite of the pandemic, our training office did not stop in providing continuous education to our staff together with our infection control. So this was early March when the ECQ and state of calamity was declared. Our infection control nurses were very active in providing updates and explaining to our nursing staff, different nursing staff, the COVID-19, and at the same time, a non-stop training for donning and doffing for all personnel who would be deployed in COVID response. And another project that we did in the nursing office is we required all our nurse managers in the nursing division to enroll in this a free online course from IntelliCare. The program is entitled Coronavirus COVID-19 for Nursing Professionals. This is just for free. So we availed on it online, and 100% of our nurse managers were awarded with certificate of completion. And the program was strictly monitored by our nurse training officer in our hospital. So all of our unit managers and department managers availed this free online course. And then the next strategy is organized internal support for our nursing staff. So through the nursing office, we have facilitated the availability of transportation, because when ECQ was already implemented in Cebu province, one of the very big problem for all nurses and all nursing staff really is transportation. That's why the nursing office coordinated with our affiliate nursing schools, one of which is St. Paul College Foundation, and also with the PWH through the assistance of the Career Executive Service Board. Because of these linkages, we were able to provide transportation for our nursing personnel. Not just nursing personnel, but the entire hospital personnel was able to benefit from this. This white Mitsubishi van was provided for us free by DPWH through the assistance of the Career Executive Service Board. And this school bus, which is still with us up to now, is provided to us for free by our affiliate school, St. Paul College Foundation. Then we also have another internal support where we ensure we provided to different nursing units a puree and vitamin C to boost their immune system. So to sum it up, 4 strategies and good practices within our nursing service: quick assembly of nursing staff, workflow optimization, focus group training, and organize internal support for nursing staff. Before I end my presentation, I'd just like to share a quote from an Army Navy officer, Joko Willing. You can't make people listen to you. That might be temporary solution for a simple task, but to implement real change, to drive people to accomplish something truly complex, difficult, and dangerous, you can't make them you can't make people do those things. You have to lead them. Thank you very much and good morning.